Hi everyone, Dr. Remy from Pain Free and Fit and Posturesize. Today I'm here with one of my old friends, Michele Herbert, who is a certified Posturesize trainer and certified Pilates instructor. Today's lesson is teaching you the 5 biggest mistakes that people get into with Pilates and how they cause injury and how can you avoid injury by following our tips. Stay tuned and enjoy. So Michele, we're going to be talking about today the 5 biggest mistakes that people make with typical Pilates. You teach a lot of classes with your students. Why don't you share with us your first of the 5 where people make their biggest mistakes?
Okay, well that would be the 100. That usually is the exercise that starts the whole routine. So the 100, modified. Legs are bent, arms are lengthened, and most Pilates instructors will teach it with the head and neck completely forward, okay, which is a lot of strain on the neck. So you want to push your face back into itself, shoulders are pressing down, and you start to pump the arms, breathing in for 5 and out for 5 seconds.
I agree. That's a big mistake with a lot of exercises. People start to goose their heads forward, and it places a lot of stress on neck muscles, discs, joints, all over the place. The other thing about this hundreds, which is typical of a lot of Pilates exercises, and I tell people all the time, both patients and exercise students, is that Pilates is a flexion-based or biased exercise routine, meaning that there's a lot more forward movement, meaning both with your head, your shoulders, and your legs, than there is extension, which is a backwards movement. So therefore, Pilates and many of the exercises actually supports this flexed posture. And in particular, one of the things that people do with posture is they're constantly slumping down during the day with their rib cage. And exercises like the roll-up and the hundreds, they emphasize more rib cage down. And we can train the abdominals a little bit more effectively in this exercise if we start to tilt or tense the tailbone under. Now, to keep a neutral spine, which Pilates is famous for, they're telling you always not to tuck the tail under. But you don't have to actually move it, but you need to tense it, which means you're taking those abdominal muscles and you're tensing the tailbone under or pubic bone up, which will engage the abs a lot more. You may not see Michele's pelvis move, but she's trying to hold her pubic bone up and tailbone under, so she's trying to avoid this kind of motion on the pelvis. When she does that, she's going to get a lot more activity in the abs. Why don't you show them those 2 corrections?
Okay. So,
and include the head correction with it so they can see it both at the same time.
okay, so a little bit of a tailbone tuck.
Face stays back. There you go.
And then pump.
That's a lot cleaner. The last thing I see a lot of times with these hundreds with patients and exercise students is that there's a tendency to hip hike. One hip comes up higher than another, and therefore you're strengthening the dysfunctional postural hold of your pelvis, your ribs, and your lower back. If you have a tendency to lean your ribs to one side during the day, if you have a tendency to hip hike up on one side, you can, if you're not sure if you have one of these postural issues, you can go to the Pain Free and Fit website where we have a free body analysis. You can learn on your own body if you are susceptible to this. But if you're constantly susceptible to leaning on one side or tilting a hip up, hip hiking, you have to keep that correction in mind so that there's equal distance between the rib and the hip on both sides. Otherwise, as I said, you're just strengthening the dysfunction. Same thing goes with rotation. If you're someone who constantly twists more to one side during your daily activities with the ribs or with the hips, that will naturally happen during the roll-up or the hundreds. And again, that's only going to be strengthening dysfunction. So, Michele, number 2. What's the second biggest mistake people are making?
Okay, in the spinal twist, there are a lot of mistakes that people make. Okay, number 1, if you don't have the flexibility to sit this way with your legs extended, and sit up nice and tall on your sit bones, then you have to bend your knees, okay, because that will help you to sit up taller. All right, so that's one of the mistakes. If people are trying to force their legs to be straight, this happens.
They don't have the hamstring flexibility.
Right.
Yeah.
So they can bend their knees, or if they have the flexibility, they can keep their legs straight. Now the arms come out, and I tell my class members all the time to think about the entire torso moving as one unit, okay? So shoulder blades are away from the ears, the belly is in, the ribs are up, and you're twisting. You're not using momentum where you're flinging, you're using your core to make the movement happen, okay? All the while keeping your ribs up, your head is moving because it's attached to your torso, like so. What people end up doing is this. Their arms are flailing, their head is bobbing. It's just, it's a mess.
They're losing the whole effect of training the spine in
Right.
rotation with symmetry, both to the right and left sides. A typical problem I see with a lot of people with lower back pain doing this also is that as they twist, they're twisting from their lower back all the way through their neck. And the way the spine is designed, rotation or twisting is very a limited function in the lower back. So to protect the lower back while you do this exercise, if you think about keeping your belly button facing straight forward like your pubic bone is, and therefore if your belly button stays straight forward, the twist is going to come more from your mid-back and neck, which is much safer on the lower back. Some people even need to train themselves by holding one finger in the belly button as they practice a twist with one arm to make sure that belly button is not following the direction of their rib cage. Also, one of the things I think that's very common with this is people have a tendency to round their shoulders as they get fatigued later on in the workout or in the set, and they also have a tendency to goose the head forward or shrug the shoulders up, and those are common mistakes, especially if your postural fault usually is a tendency to move your head forward or shrug one shoulder up. You have to be aware of that.
Right.
So, the third biggest mistake we find in Pilates exercises is during the front and back. Michelle, would you like to explain that?
Sure. Okay. So there's two different ways that you can support your upper body. You can be on your elbow, which should be right underneath your shoulder, or you can be all the way down, arm extended, head resting on the arm to keep your head in alignment with the spine. Okay, but whatever two of those positions you take, you need to pull your lower abs in, which stabilizes the lower back. The top leg lifts to just about hip height, okay? And you want to really lengthen that top leg, like you're pushing it long, okay? And
right through the bottom of the foot.
Right. You can point your toes, you can flex your foot, as long as that leg is really extended. And you're going to bring the leg forward and back, all the while keeping that lower belly pulling in. And again, you can have a pointed foot or a flex foot. So the most common mistakes is the class member is not pushing the leg long, they're not engaging their core. So what starts happening is your upper body is kind of like flopping forward and back. I see this all the time in classes.
Look at all the instability and excess motion in the low back that can
my
hurt
shoulder is riding up into
well
my
as the
ear.
shoulder joint.
Yeah. So always got to maintain that long neck, keep that leg long, belly in.
I think also, besides the hip hiking effect, if you're not pushing your foot long, this hip moves up into the rib, which is called hip hiking, that compresses the lower back. A lot of students don't utilize the hip flexors and the extensors correctly. As the leg's coming forward, that hip bone should stay centered in the socket. And a lot of people with an anterior hip malposition, again, if you're not sure what that is, you can look on the Pain Free and Fit website. We have an analysis. It's a very common problem, where your hip flexors, especially if you're doing Pilates without other exercises such as strength training in the gym, such as doing yoga, which balances the flexors and the extensors, that actual hip bone is moving forward in the hip socket. And many times this will cause recurrent pain in the groin, the front of the hip. So one of the keys I find with training patients with this is you need to tense the buttock actually as kind of a counter check as the leg is going forward. That helps to keep the hip bone back in the socket. In fact, if you put your finger right behind your hip bone, you can actually feel the buttock tense. Why don't you give me a little tension there, Michelle? And as that leg's going forward, it's helping to drive that hip back in the socket, that helps to center it. And likewise, as the leg is going back, if you have a tendency to overutilize lower back muscles because you have weak buttocks, that's also a very common postural problem. You can emphasize the buttock contraction by, again, tensing the tailbone under. You don't need to move it under, but as if you're tensing your tail under, that will engage your abs, help to keep the low back stable, and help you recruit or use more of that glute or buttock muscle. And mistake number 4 is
leg circles. So this is a modified position. This leg is bent. This is more advanced. We're not even going to go there today. I don't usually teach that anyway. So if you don't have the flexibility to have your leg straight, you're going to bend your knee because the motion is coming from the hip, okay? So if you do have the flexibility, you can straighten the leg. You're going to, again, pull your lower belly in a little bit, okay? And you're thinking about pulling the leg down into the hip socket, okay? Not making it long, pulling it back down, okay? Arms are long by the sides of the body, shoulders are down, so you still have that long neck, okay? And you're circling the hip, okay? So again, it's a very controlled motion. You're not just going to be circling aimlessly. It's very controlled. You pause, you circle. So the most common mistakes that people make is, number 1, they make the circle too big, so they lose their whole form. So they start circling.
Look at all the motion in her pelvis when she does it abnormally, how much stress that creates on the pelvis, the ribs, the lower back intervening.
And what also happens is if they don't have the flexibility to keep the leg perpendicular to the floor, this starts happening. This is what they do.
And that's a long lever now acting on the lower back, causing an extension moment, which can be very injurious.
Right, so there's nothing wrong with just bending the knee and creating the circle. And I tell people to visualize the hip circling, not so much the leg.
And that, completes a topic that we've gone over many times before in Posturcise, which is motion should start proximally at the center of the body and run distally towards the end. Without it, you lose total stability of the joints involved. One of the things that I see also with this exercise is if someone has the tendency to stand or sit with their leg turned out more on one side, called an external hip malposition, they'll have a tendency to emphasize that during this motion. And that is only perpetuating the mechanical stress at the hip joint that leads to arthritis and strains and ITB problems. So it's a good idea to try to keep your legs symmetrical, meaning from the start we're having toes up. As we come out, we're limiting the amount of the toe out. We're not letting it just flail all the way. And as we come in, we can actually turn it in a little bit. And if that's a problem where you externally rotate, you'd actually want to emphasize the correction, which is the internal rotation, as you come around. That can go a long way to preventing hip injury and problems. And the 5th biggest mistake during most Pilates routines is
the leg pull. Okay, so this comes from the plank, which is done in yoga sometimes, but there's movement. So you want your hands to be slightly externally rotated to protect the shoulders. To get into plank, you want to maintain shoulders away from the ears. The face is back, so you don't want to let your head goose forward. Okay, so keep the face back. And then you want to pull your lower abs in. So here's the leg pull. The leg comes up, long, all right, and you're also engaging the glute muscle on that leg that's up. And here's the motion. So you're flexing in the standing ankle, maintaining that proper posture.
Notice Michelle's not twisting her pelvis. The typical tendency is you're going to want to drop on that leg that's up, meaning your whole pelvis is going to twist to that side. And the other mistake is the hip on the standing side is going to want to hip hike up, and the ribs are going to want to lean in. That again produces a lot of low back pressure, takes away from the effectiveness of the exercise. Michele had great shoulder posture. You notice when she was doing it, her shoulder blades were down and flat against her body. her arm rotates out, the fingers turn out, because most people's shoulder posture has a tendency to internally rotate too much. That stresses the rotator cuff. So a lot of people doing this exercise wind up with shoulder pain because they're perpetuating that dysfunction. So besides the shoulders down and back, keeping that arm turned elbow in or fingers out really helps to release the pressure on that shoulder.